Hi, guys. Welcome to another episode of Instrument Innovations. Today, with me, I have CEO and co founder of Ascendco Health, Brian Reed. I also have with me Platform Specialist of UF Health, Alex Brown. Today, we're going to talk about UF Health's journey of how it got to Ascendco's inaugural SPD of the year. We're going to talk a little bit about that. We're going to also talk about, how analytics played a big part of this. So let's just jump right into it. Thank you for being here today, guys.
Yeah, absolutely.
Just to start out, Alex, if you could just give us a brief overview of UF Health's processing journey, and then just what it meant, winning this Ascendco inaugural SPD of the year, what that means to you and the team.
Absolutely. So for UF Health, our focus this year has absolutely been innovation and improvement. So we implemented a large-scale offsite reprocessing facility that services five different facilities. So we no longer do on-site SPD processing, which has vastly increased our throughput and our quality. So we've been doing that, focusing on harnessing our data-driven insights and just really focusing on supporting our healthcare systems and operating rooms. Winning this SPD award, the year award, has really validated our dedication and hard work this year, and we're super honored to be able to receive it.
Okay. And you talked about some data driven or some key drivers that led to that. Can you just elaborate just briefly on what some of those key drivers were?
Absolutely. So our main mission at UF Health, and I think many of the other SPDs, is patient safety overall. So our initial focus was quality related instrumentation improvements. So by leveraging our analytics, we were able to do these really small process changes, which cascaded into these massive effects, reducing our overall quality event reporting or increasing quality event reporting, but overall reducing it because we weren't experiencing any quality events, which reflected in our lowering of surgical site infection rates.
Okay. I mean, you talked about analytics. Analytics do play a big role in that. How did analytics play a role with identifying areas of improvement within your sterile processing areas?
Sure. So our analytic platform is a big difference that sets us apart from manual tracking or even
Hmm.
more like first generation tracking systems. It really gives us a really clear view of where we are and how where we can focus changes that can really, like I said, cascade into major improvements in our system. So it's really getting the clear view of where we are and where we want to be and how we can get there.
Okay. I kind of want to revert a little bit. We're talking about analytics and platforms. And speaking of that, Brian, could you give us a brief overview of how there's two types of platform specialists? We have on-site, and then we have a regional platform specialist. In this case, you chose to go with the on-site. Can you tell us how that decision making came and why you chose that?
Why we decided to have an on-site platform specialist at UF Shands?
Yes.
Yeah, it's as simple as they had a lot that they wanted to accomplish and do. When you generally look out at the hospitals that we're working with or that we're engaging with, you see a lot of activity occurring just to maintain stabilization. Um, but if you have initiatives, goals in mind, things that you want to improve or accomplish, you have to be able to move beyond that layer of stabilization and focus on continuous improvement. And if you want to be continuous in anything you do, you have to have continuous focus. And so that's what Alex brings to that team is the ability to sustain continuous improvement.
Nice. So once you began your analytics journey, and of course they have the platform specialists in place, Alex, what did you find some of the most surprising insights that help you guide to make the decision making and help you to improve in SPD as a whole?
Sure. So traditionally, managing SPD departments came down to reactive decision making.
Hmm.
So all your staffing, all of your inventory, your ordering, your procurement all came down to, hey, we need this, this needs to happen. But the problem that it's solving had already happened, and we're just trying to prevent it from happening in the future. So it kind of feels like you're always catching up versus being ahead of the problem. One really surprising thing with analytics is the ability to kind of in real time make those adjustments, but even more importantly, proactively make those adjustments so you never feel like you're falling behind. You're always ahead. So these little tiny changes, you have a bottleneck in decon, you can immediately look at your dashboard and see that your decon sets are increasing. You're having a backlog in decon, and you can go ahead and take somebody from sterilization center that's not really working right now because of that bottleneck and move them over to decon. And then you all of a sudden reduce that bottleneck and you have your pack and prep working efficiently. And eventually now that sterilizer person that wasn't really doing much now has a job to start loading up sterilizers.
Okay. And then having the right people in the right place is crucial. Um, in the roles during this transformation, how did you ensure that the team was equipped to handle that transition?
Absolutely. So one of our biggest challenges was increasing a buffer inventory to
Hmm.
cover for transport times. So we did utilize Ascendco Analytics to kind of develop that par level. And then
Hmm.
we trained our instrument coordinators. So we had a group of instrument coordinators who were super like data and evidence driven, who really, really wanted to order the appropriate amount of sets without being irresponsible with the healthcare system's money. So utilizing those usage reports, we had in services, we did classes on how to pull these usage reports, how to read them, and we were able to really, really fine tune our expansions and our ordering of our sets using those things and teaching the people who really, really enjoyed doing that kind of work on how to use them.
Okay. Sounds like communication between you and between the tracking system will play the key part in this large scale project. So how do UF Health, foster collaboration between the teams, between the tracking system, to ensure this big transition to the offsite, and how has that helped sustain for long-term success?
For sure. So when we first started the project, we established a bunch of standing meetings between three major departments, the OR, sterile processing, and supply chain. These were the major stakeholder departments within our processes. So we really wanted to involve them. Interestingly enough, even though our transition's done, the projects are over, we're kind of just doing fine tuning and data governance, those meetings haven't gone away. We still meet every single week with these departments just to update processes, keep this transparency open. I think without the Ascendco platform, which encouraged it during implementation, I don't think we would still have that kind of open line communication and transparency that we have now.
Okay. And Brian, how does that collaboration, as far as the you have on a big perspective, if I was a person that's interested in maybe a tracking system, how do I go about those first steps of getting that implemented and getting that started? What would you say would be my first steps for that?
First steps for an offsite to procure a software system.
Implementing the tracking system to help with that.
Well, I think the relationship has to start well before the software is implemented. You know, you see, like Steve Jobs made a comment. Don't hire really smart people and tell them what to do.
That's
Um,
right.
that's one of the things I think that UF Shands did quite well. This is not the first, second, or third, or fourth, offsite planning team that I've been a part of, but it is the one that I was able to drive the most benefit by being a part of it, and that was a testament to the leadership team at UF Shands for bringing in suppliers and partners that they thought would contribute to the planning process. And we did, because they set the stage for the right environment. I think that is the foundational reason, the one single reason that they've had success, whereas many others haven't. Um, so, I I just think big picture, you have to know what you're doing it for. You have to know why you're going down this path, and there has to be a good reason behind it. And if it makes sense, then naturally that's something you can get people on board with. And once on
Absolutely.
board, to Alex's point, if you have the right infrastructure and the right cadence of meetings and you're listening to people in the right way, you can drive collaboration and get smart people to speak up. And so, turns out, UF Health has a lot of smart people internally, and they spoke up. So procurement of a software systems an afterthought. So, you kind of think about it like this. If you're driving a 15-foot speedboat in a lake, you don't need very many instruments to be successful.
That's
But if
right.
you're driving, a 300-foot ship in the ocean, your dashboard has to be much more accurate and you rely on it a lot more. Same metaphor could be used for, flying a little Cessna as opposed to a 747, right? When you go to an offsite reprocessing center, you need to rely on your instruments. And if you've got the instruments that are in a Cessna P210 while flying a 747, you're in some pretty big trouble.
This is true.
A more sophisticated platform, you need something that can be more agile and responsive to your needs. And that's what our platform offered UF Health, and that's
Absolutely.
how we've contributed to their success.
Okay. Speaking of success, now that we're talking about UHF has successfully transitioned into the model of the offsite that they are, what are some of the next goals for the sterile processing department moving forward in the future?
So, moving forward, our focus is refining our data and analytics to really lean out our processes and automation. One of our big goals is to reduce the reliance on scanning sets through the utilization of real-time location services and tagging. We're partnered with a company called iLocations,
Mm-hmm.
who's currently helping us do that, where they tag each individual set, and we're working on moving towards a spot where sets will no longer have to be manually scanned into storage. They're just automatically funneled into there by our system.
Gotcha. And so, how do you see technology and analytics continuing to shape the future um, at UHF?
So, with data being as invaluable as it is,
Mm-hmm.
the more accurate and the more lean we get it, the only better it'll get. We'll be able to more accurately predict ordering and e-procurement. I know Ascendco is coming out with a new product soon for e-procurement that we're really, really looking forward to. That will help us focus on it and just be really good financial stewards of our budget to ensure that we're only purchasing sets that we need to versus what we feel like we need. All evidence practices only.
So, Brian, I'll kind of put that same question out to you. In the future, what do you see for technology and analytics future as a whole?
Yeah, look, you're trying to achieve one singular thing, and that singular thing is precision,
Yep.
right? Precision across all fronts, whether it be your workflow, your process, your people, your preference cards,
Yep.
your staffing models, your inventories, your backup records. You just want to achieve precision.
That's
And
right.
in order to achieve that, you have to have a couple of components. You have to have somebody that is operationalizing the inputs so that you can see what's happening, right? So you can see the process. That's where Alex comes in.
Yep.
You have to have a captain who is interpreting the outputs. That's where Sarah Vinson is an all-star. And so you're leveraging analytics not to change the shape or drive a solution. You're leveraging them as a tool to feed into your initiatives.
Mm-hmm.
And the UF Health team, and in this case led by Sarah Vinson, is now really addicted to driving improvements. And so what they know is, if you automate things, you can simplify them and make them more repeatable and
That's right.
more predictable. So this is why you see them leaning into the automations. I would suspect this is why they're asking us to do these sorts of things. It's just so that they can better use, our tool for driving, continuous improvement and setting a new bar.
So we've got a time for one more question. So I guess that question that I would ask would be this, Alex. What would you say that your top three takeaways from health's journey that other healthcare systems could learn from?
Ultimately, sterile processing and how good it is comes down to the people. Investing in your people, your training, supporting them, ensuring they have the facilities they need, the tools they need to perform their job effectively is so important. One of those tools is Sonar, our Sonar and SQ Track, our education platforms, our notification platforms, our guidance, our help documentation, our support team. Everyone's there to support your team. That's my number one takeaway is always to focus on the people. Second is how valuable the data is. Ensuring that you have solid data governance will make sure that your outputs are accurate and actionable. And then thirdly, communication, cross-functional communication. So making sure that you have communication with all the departments, not just SPD. Make sure that your communication with your OR is open and positive. And same thing with supply chain. Make sure everyone has open, transparent conversations and communication. It's super important for effectively running your department and for the patients. We're here for the patients.
Yep. Anything to add to that, Brian?
Can you restate the question for me?
So the question was, top three takeaways from UHL's journey, and what could other healthcare systems learn from this?
Yeah, I think when you take big steps, you motivate people, and you have
I
a
agree.
team down there with a lot of pride, and that creates this kind of intrinsic motivation and this standard for which they operate. So there's just value regardless if you're moving offsite or moving insite. There's just value in taking big steps.
Agree.
The other thing I think is I would be weary of looking in from the outside is don't think that, you pick a site and you design a facility that everything else is going to fall into place. Behind the shiny building that UF Health built that people love to tour, there was a lot of hard work and a lot of decisions made.
Absolutely.
And they managed to focus on the right things. There was a tremendous amount of preparation that took place and it started with refining the accuracy of preference cards. So before you should take something, off-site, you got to make sure that your preference cards are accurate, or you're going to get into trouble very quickly.
Absolutely.
I would say the last thing that I would just, take away from it is do it for the right reasons. Offsites are not a good solution. You don't build an offsite to save money or just to build an offsite. You only do it to solve one problem, and that's a space issue, right? You either grew out of your space or you want to use your space for something else. That's it. If anyone else is looking at doing an offsite for any other reason, it's not the right answer. But if you've got the right reasons for doing it, you can get people behind it. You can take a big step. You can motivate your team, and if you do the right preparation and build the right team, you can make it successful.
Right. So, folks, you heard it here first. UF Health's journey, how they made it to Ascendco inaugural SPD of the year. We had our host today, Brian Norris, with my guest Alex Brown, and also CEO and co-founder Brian Reed. So, here's for another episode. We'll see you next time.